Hi, my name is Alexandra Diaz, and I will be doing a mini presentation on the field that I chose, which is nurse practitioner. This career may take you up to 2 to 4 to 11 years of college, depending on where you go for education. It also depends if the nursing program is a regular nursing program or an accelerated program. Some nursing accelerated nursing programs, um, they last 2 years depending on the previous educations that you have, such as associates in science and master's degree in science. The process of becoming a nurse practitioner can be very stressful, so nursing programs are very intense and self-care is very important. So this is just a little picture demonstrating that nursing students most often remember to self-care. Nurse practitioners do the same work as doctors. They have the credentials to diagnose and write prescriptions. Nurse practitioners can work under the doctor's supervision and work independently as well. They can order x-rays, laboratories, do physical exams, and diagnose patients. They can treat patients with mental health. They can do a lot of similar work as doctors. They just have less credentials and obviously less, they don't do everything that the doctors do, but they do similar work as doctors. Just like a doctor, you can choose your specialty in the health field. Family nurse practitioner. There are many other specialties that nurse practitioners can get certified on, such as acute care, adult care, mental health, cardiac, and pediatric. Also, you can get certified in women's health, oncology, dermatology. It depends. If you are being certified but not licensed in the state, you can choose your area of where you want to specialize. Some of the certifications agencies are American Association of Nurse Practitioners and American Nurses Credential Center. Nurse practitioners can work in different type of facilities like long-term care. They they can work in hospitals as travel nurse, or they could also work in the when they have their own practice. At long-term care facilities, they gain experience about people with chronic illness, among others. At hospitals, they are more open to situations and gain more experience. What I mean with that is that at the hospitals, healthcare professionals, they are constantly exposed to many different situations and they're able to get more experience in a way. Other than long-term care, they taking care of um, patients that have probably a long-term care disease and they there every day. They become familiar with the patient and they know this is a little picture like with humor in a way, because nurses, CNAs, and doctors, nurse practitioners, they become very familiar with patients at long-term care. When it comes to salary, nurse practitioners' salaries can average from 128,567. It also varies from 119,300 to 139,667. That is dependent on certifications, um, add-on skills, experience, and if you are licensed in the state that you're in. Because of their hectic job and dedication, nurse practitioners have little time for their breaks. As a healthcare worker, I myself experience that healthcare workers, they some work through their breaks for patient care. And this is another picture as for humor about break room for nurses. Other areas of work where nurse practitioners can practice their profession is acute care hospitals, inpatients hospitals, observation unit, emergency room, hospice, home care, independent living facilities, assisted living, long-term care, nursing home, inpatient, outpatient rehab, skilled nursing facilities. Thank you for watching. And again, my name is Alexandra Diaz.